Administering medications by intravenous bolus. Check accuracy and completeness of each medication administration record or computer printout with prescriber's original medication order. Check client's name and medication name, dosage, route, and time for administration. Recopy or reprint any portion of MAR that is difficult to read. Collect information necessary to administer medication safely, including action, purpose, side effects, normal dose, time of peak onset, how slowly to give the medication, and nursing implications such as the need to dilute the medication or administer it through the filter.
Okay, so you would check your drug book, your drug reference book for that.
If pushing medication into an intravenous line, determine the compatibility of the medication with the IV fluids and any additives within the IV solution.
Okay.
Perform standard steps, assess IV or saline heparin lock, insertion site for signs of infiltration or phlebitis.
Okay, so before preparing your medication, you're going to go into your client's room and you're going to assess the site, making sure that there's no signs of phlebitis, that it's infusing without any problems, they're not complaining, it doesn't feel cool to touch, that your site looks fine. You're going to talk to your client while you're in there. You're going to educate your client, letting him know that you're going to be given a medication through the present line that they have, whether it's a heparin lock or it's an infusing IV, and educate them on that medication.
Prepare ordered medication from vial or ampule using aseptic technique. First check. Check label of medication carefully with MAR. Second check.
Okay, so first you check your medication as you're taking it out of the drawer. That's your first check compared to your MAR. Make sure you check your expiration date. Okay.
Take medication to client at correct time. Identify client using at least...
How about if I draw my medication up? Are you ready for that? Oh, go ahead.
You're supposed to identify your client with the identifiers. Compare label of medication with MAR at client's bedside. Third check.
Okay, hold on 1 second. Draw my medication up that I'm going to be administering. Do that? Sorry about that. This is interesting. I don't know if you can see this, but this is a needle protector that just slides up over the needle. You'll see when I get ready to, after I give the injection. Okay, make sure I have the right amount. I'm going to take in my medication. Alcohol. Okay. Going to the room? Yes.
Perform hand hygiene. Apply gloves.
Door. Identify myself. Washing my hands. Don't get as much as I did, and then take your while to dry your hands. Apply your gloves.
Administer medication by IV push, existing line. A. Select injection port of IV tubing closest to client. Whenever possible, injection port should accept a needleless syringe. Use IV filter if required by medication reference or agency policy.
Okay, so you have two methods you can use. You could be, if this was connected to my client, you would be selecting the port that's closest to your patient. So if I have a infusing line, I would inject it here, okay? Just going to put this here right now because I'm actually going to be giving it through a heparin line. But as she talks, I'm going to show you, okay?
Clean off injection port with antiseptic swab. Allow to dry.
In the port.
Connect syringe to IV line.
That's my syringe here.
Insert needleless tip or small gauge needle of syringe containing prepared drug through center of injection port.
Okay.
Occlude IV line by pinching tubing just above injection port.
So you would pinch back here, okay, as you're going to be giving your medication through your port. Okay.
Pull back gently on syringe's plunger to aspirate blood return.
All right, so you're going to always aspirate back. Look for a blood return that identifies that, yes, that catheter, that angiocath that's in place is in the vein. Okay, you'll see a blood return. All right.
Release tubing and inject medication within amount of time recommended by institutional policy, pharmacist, or medication reference manual.
Okay, I'm going to release the tubing, then I'm going to inject my medication. All right.
Use watch to time administration. Intravenous line is sometimes pinched while pushing medication and released when not pushing medication.
Okay, so now with some medications, it needs to be pushed slowly because it's an irritant. So you want to make sure if I know that I'm administering an irritating drug, I want to make sure that I deliver that medication very slowly. And it may be delivered over a minute or over 2 minutes. So you should stand there and you should time that medication delivery. So yes, always have on your watch. So you can give a little bit and then wait, give a little bit and wait, because that's an irritating drug. As it goes in, they're going to say, ooh, that burns. Okay, what if you stood there and you flushed it in all at one time? If it's an irritating drug, then what it's going to do is going to blow your line. Okay, and you don't want to do that, or you're going to be constantly starting new IVs. Okay.
Allow IV fluids to infuse when not pushing medication.
Okay, so in between you pushing, then you're going to unpinch it and let your infusion, your medication, your IV fluid to run.
After injecting medication, release tubing, withdraw syringe, and recheck fluid infusion rate.
So I check again, make sure everything's infusing, everything is fine. Okay.
Administering medications by IV push.
Okay. So now we're going to provide a medication just through a lock. So it's no infusion running, because sometimes you'll have clients who have just a hep lock because they're taking enough PO, they're taking enough by mouth that they really don't need fluids constantly running. So therefore, all you're going to do is just provide this medication. Okay?
Prepare flush solutions according to agency policy.
Okay, so I have 2 saline flushes.
Saline flush method, preferred method. Prepare 2 syringes with 2 to 3 milliliters of normal saline in syringe.
Okay.
Heparin flush method is the traditional method. Prepare 1 syringe with ordered amount of heparin flush solution. Prepare 2 syringes with 2 to 3 milliliters of normal saline.
Okay, so whether you're providing heparin or not, it is the hospital or the facility's policy. But with either, you're going to have 2 saline syringes. If the facility or the hospital requires that it's a heparin, then you would have saline, antibiotic, saline, and then your heparin. So that's your SASH method. S, A, antibiotic or your medication, S, then your heparin. And remember, again, we're going to talk a little bit more about heparin. but you want to be very careful and make sure that you give the correct amount of heparin, or you can really seriously hurt someone. And you don't want to kill your patient. Gonna kill somebody. All right.
Administer medication. Clean lax injection port with antiseptic swab.
Okay.
Insert syringe containing normal saline into injection port of IV lock.
I'm going to use a needleless system here. Okay, that's for my medication. Okay, I'm going to do saline in the center. Pull back, blood return. You're going to find that the mannequins aren't going to flush very well, so okay. Great. Okay, tap it using the scoop method.
Pull back gently on syringe plunger and look for blood return.
Did that.
Flush IV lock with normal saline by pushing slowly on plunger.
Did that.
Remove saline-filled syringe. Clean lax injection port with antiseptic swab.
Oh. Okay.
Insert syringe containing prepared medication into injection port of IV lock.
Okay, so I don't know if you can see this, but this is a needleless system. Wanted to get a chance to show you what the needleless system looks like. Okay, and it has like a little clip on it, so you're going to slide it over your, I hope you're going to slide it. No, that one doesn't work with this. Oh, I call myself. Wait, let's see. It doesn't work with this syringe. Okay, let's switch so you can see how it works. Let me show you how it works. Okay, needleless again. See the little clamp? You'll pinch it. You see? Okay. So you pinch it, slide it into the center, and it actually snaps on. Now this has saved many nurses, reduce the risk of nurses having needle sticks. So they're a wonderful system. If your hospital, your facility uses a needleless system, that's exactly what you want. So when you get in charge, really push for that. Okay? Go ahead.
Inject medication within amount of time recommended by institutional policy, pharmacist, or medication reference manual.
Okay, and we talked about, this doesn't really push, but we talked about how making sure that you're timing the medication. If it's going in, it may say you can give 3 mLs over 5 minutes. Okay, there's a system that you're going to calculate this out, and we're going to do this in medication calculation class. Okay.
After administering bolus, withdraw syringe. Clean lax injection port with antiseptic swab. Attach syringe with normal saline and inject normal saline flush at the same rate the medication was delivered.
Why not any faster, do you think? Exactly. Because it's medication in that line. And if I just flushed it quickly, all that medication that was in there is going to quickly go into the vein. So the same time that you use to put the medication in is the same time that you use to put this flush in. You see that being done? Probably not. Okay? But make sure that you do it, because that's the way it's supposed to be done. It's all about client comfort.
Heparin flush option. Insert needle of syringe containing heparin through diaphragm. Inject heparin slowly and remove syringe.
My facility doesn't use heparin.
Ms. Murray, I have a question.
Yes.
I noticed that you have several needles on the tray. How can I know what's my med and what's my flush?
You would identify it either with tape, you label it, and for me, what happened is my medication was actually yellow. Okay, so I didn't worry about labeling. But you want to get in the habit of always labeling your medication because you may have 2 or 3 clear solutions. And so you want to make sure that you do that. Okay?
Dispose of uncapped needles and syringes in puncture-proof and leak-proof container. Remove and dispose of gloves. Perform hand hygiene.
Okay. Check my site. My client has a biohazard container in the room, so I would dispose of that. Or if not, I would bring in a biohazard container with me. Okay.
Assess client's status after giving medication to evaluate the effectiveness of the medication.
Okay. So I'm going to look at my client. I'm going to look at his site, make sure it's not red, it's not swollen, it's not cool, it's not complaining of pain. Okay.
Ask client to explain medication's purpose and side effects.
Okay, now what did I tell you this medication was for? Exactly.
Record medication, dose, time, route, and time of administration. Report any adverse reactions immediately to healthcare provider because they could be life-threatening.
Okay.
Client's response indicates need for additional medical therapy. Record client's response to medication in nurse's notes.
Okay, so I would wash my hand and tell my client that I'll be back to check on them, and then go out to my cart and do my documentation, making sure that I assess that site really well so that I can have something to compare it to when I go back in the room again. And in, 15 to 30 minutes, we should be back in. Remember, with an IV, it goes directly into the vein, so you're going to see a quicker response. So in about 15 minutes, you want to go back in and make sure your client is okay. All right, that's it.